This is our second topic today, and it includes growth and development of children. It's a vast topic, so this video will be part 1, in which we will discuss the normal parameters. We often hear people refer to children's growth and development. Are growth and development the same thing? What does each of these terms mean? Growth refers to specific body changes and increases in the child's size, such as height, weight, head circumference, and body mass index. These size changes can easily be measured. Development typically refers to an increase in complexity, a change from simple to more complex, involves a progression along a continuing pathway on which the child acquires more refined knowledge, behavior, and skills. The sequence is basically the same for all children. However, the rate varies growth. We define growth as specific body changes and increases in the child's size. During the first year of an infant's life, babies can grow 10 inches in length and triple their birth weight. After the first year, a baby's growth in length slows to 5 inches a year for the next 2 years and continues from age 2 to 3 to puberty at a rate of 2 to 3 inches each year. A major growth spurt occurs at the time of puberty. Girls generally enter puberty between ages 8 to 13 years of age. Boys usually enter puberty at ages 10 to 15 years of age. Similarities in growth. Growth proceeds from the head downward and from the center of the body outward. Children gain control of the head and neck first, then the arms, and finally the legs. At birth, the brain, heart, and spinal cord are fully functioning to support the infant. As children grow, the arm and leg muscles develop, followed by the finger and toe muscles. Differences in growth. Children differ in their growth. Some children are taller, some shorter. Some children are smaller, some others are larger. These differences are completely normal. Normal growth is supported by good nutrition, adequate sleep, and regular exercise. Children do not grow at perfectly steady rates throughout childhood. Children will experience weeks or months of slightly slower growth followed by growth spurts. Difference in the amount of growth can be a source of self-consciousness for some children. It is important to help the children in your care understand that these differences are normal, that each child is special, and to help children develop a sense of self-acceptance. Principles of growth. How can you help children understand their differences in growth? Show pictures of various stages of growth in individuals. Principles of growth. If you detect that a child is self-conscious about her size, how would you help her work on increasing her self-acceptance? Either individually or in a group, talk about how things are different but equally important and valuable. Example, litter of puppies or kittens, different in size and color, but they are all special and will grow into wonderful dogs and cats. Principles of growth. If you have some concern about a growth-related issues about a child, how would you approach this issue with the parent? Share information and typical growth patterns with parents. Ask the parents if they have questions. Do they have interactions with a doctor? If not, suggest local resources. Key points. Growth is defined as specific body changes and increases in the child's size. Growth proceeds from the head downward and from the center of the body outward. Children differ in their growth. Key points. Development typically refers to an increase in complexity, a change from relatively simple to more complicated. Development usually involves a progression along a continuous sequential pathway on which the child acquires more refined knowledge, behaviors, and skills. The sequence is basically the same for all children, however, the rate varies. Principles of child development. Developmental sequence is similar for all. Development proceeds from general to specific. Development is continuous. Development proceeds at different rates. All areas of development are interrelated. Key points. There are certain periods of time when children are especially receptive to their surroundings and interactions with other people. These periods of time are tied to brain development and readiness for learning. Both will directly affect the achievement of developmental milestones. Experiences and environmental influences that impact brain development. Everything you do in the child care setting has an effect on the child's development and learning. How you diaper, feed, and put to sleep, the way you greet, and the way you comfort, the amount of space the child has to play in, and the ambient lighting, the songs you sing, the toys you provide, the meals you serve. These things and more all have an effect on the development of a child's brain and their ability to socialize and learn. Implications for learning. Why should child care professionals learn about principles of child development? Care and the environment can support or hinder development. The knowledgeable caregiver can support a child in learning new skills. When a child is struggling with a new skill, timely intervention can help him overcome a problem and catch back up. The knowledgeable caregiver can detect indicators of possible delays and can help get the child the assistance he needs. Key points. All of your interactions with a child have an effect on the child's development and learning. It is important to be aware of what the child is learning while in your care.